Hey everyone, welcome to today's lesson on common pathologies associated with an MRI of the abdomen. In this lesson, we will discuss characteristics of routine pathologies seen on these types of scans. It is important to remember there are many pathologies associated with the organs of the abdomen. These are just a few common ones a technologist should be familiar with. Let's get started. First, let's dive into some pathologies that may be seen on studies of the liver. Tumors located in the liver can be classified as benign or malignant. Two common tumors are hemangiomas and hepatocellular carcinoma. Hemangiomas are benign vascular lesions with well-defined margins. On a T2 weighted image, these appear as hyperintense or bright like a light bulb. T1 weighted images show hypointensity, and post-contrast imaging demonstrates some peripheral enhancement. Hepatocellular carcinoma, or HCC, is a type of primary liver cancer that appears bright on a T2 weighted image. On post-contrast T1 weighted images, the arterial phase shows early enhancement but fades or washes out in venous or delayed phases. This is a key diagnostic feature of HCC. Timing of contrast is extremely important in liver studies due to the vascular nature of the organ. It is important for technologists to pay careful attention when scanning in order to catch both the arterial and venous phase of injection. Fatty liver disease, or hepatic steatosis, involves excessive fat accumulation in the liver linked to obesity or alcohol. On MRI, it appears as diffuse T1 hyperintensity due to fat content. T2 weighted images are usually normal, and no significant enhancement occurs post-contrast. The most important sequence in diagnosing fatty liver disease is in and out of phase imaging, which is a gradient echo sequence with two different TE values but the same TR. The liver containing microscopic fat will appear hyperintense on in-phase images but will lose signal on out-of-phase images. Hemochromatosis is iron overload in the liver, leading to tissue damage. On MRI, it causes T2 hypointensity due to iron deposition, most apparent on gradient echo sequences, where magnetic susceptibility creates signal loss. T1 weighted images may also show hypointensity. Cirrhosis is end-stage liver fibrosis from chronic injury, causing nodularity and portal hypertension. On MRI, the liver appears shrunken with a nodular or bumpy surface. Scar tissue will appear bright on T2 weighted images. Post-contrast T1 weighted images demonstrate irregular enhancement. Now let's take a look at some common pathologies of the kidneys. Polycystic kidney disease, or PKD, is a genetic condition causing numerous renal cysts, leading to kidney enlargement. On MRI, kidneys are enlarged with multiple T2 hyperintense cysts of varying sizes, with thin, non-enhancing walls. Additional cysts may form in the liver. These cysts have the appearance of bubbles. T1 weighted images show hypointense cysts. It is important to consider the field of view in these studies, as the size of the kidneys may require an increase in the field of view in order to cover all necessary tissue. Renal cell carcinoma is the most common kidney cancer. On MRI, renal cell carcinoma is a heterogeneous T2 hyperintense mass, often with necrotic or hemorrhagic areas. On T1 weighted post-contrast images, renal cell carcinoma enhances with irregular margins. Timing of post-contrast images is important as these cancers enhance quickly due to arterial blood flow. Finally, let's look at a couple of pancreas pathologies. Pancreatitis is inflammation of the pancreas and is acute or chronic. Gallstones are the leading cause of pancreatitis due to blockage of the bile duct. Acute pancreatitis on MRI shows pancreatic enlargement and edema. Chronic pancreatitis shows atrophy and ductal dilation. Pancreatic cancer is a malignant ductal tumor, often in the pancreatic head. On MRI, it's T2 hypointense, sometimes causing ductal obstruction depending on the tumor location. T1 weighted post-contrast enhancement is slower compared to normal pancreas. Therefore, a dynamic injection technique may be requested from the radiologist. This has been an overview of common pathologies associated with the abdomen. Thanks for watching.